we do know that the major genetic contribution to age of onset is the length of the polyglutamine repeat. And so you can provide some broad areas of predictability based on that. We also know that somatic expansion of the CAG occurs in selective tissues and occurs most obviously in the areas of the brain that are subject to neuronal loss and atrophy. This includes the striatum, the caudate, and the putamen. Somatic cell instability appears to be a factor that can also influence age of onset. And there have been very significant genetic studies that have really shown that somatic instability is an important factor. The challenge is how to really address this as a factor, because of course you don't know when to treat, and you also have to get into all these cells. Delivery is a major impact for all approaches to Huntington disease, and that's why I'm seriously in favor of oral drugs, because Huntington disease starts off in the basal ganglia, but then has broad impact throughout the brain. It becomes a diffuse brain disease. And if we're going to treat Huntington disease, we need to get target engagement throughout the brain. Oral drugs that are taken easily and essentially are very soluble, lipid soluble, reach their target throughout the brain very quickly. And this remains a major challenge for approaches that are either involving selective introduction of something that knocks down Huntington in the basal ganglia, or something that's delivered intrathecally, where it's uncertain whether you're getting target engagement in the deepest areas of the brain. So these remain challenges. I, for one, believe there should be multiple approaches to therapy. Huntington disease is going to be like many other diseases, like multiple sclerosis, forms of cancer, where combination therapy becomes the paradigm for, based on perhaps a drug that's orally taken, on which other mechanisms can be interfered with. Of course, knocking down the mutation itself and decreasing mutant Huntington represents a very feasible approach, if only we could get significant target engagement throughout the brain, which remains a challenge.